Every year, millions of people around the world suffer a hemorrhagic stroke, a bleed inside the brain. Unlike a clot that blocks an artery, a bleed is like a leaking pipe inside your skull. The blood destroys brain tissue. The pressure builds. The damage spreads. For decades, the dream has been a drug that stops the bleeding quickly, before too much damage is done. Early studies of a drug called Recombinant Factor VIIa showed it could slow bleeding. It made sense. Give it early, stop the bleed, save the brain. But earlier trials treated patients too late. So researchers designed a new trial called FASTEST. They would treat patients within 2 hours of symptom onset, the earliest ever attempted. The results are now in, and they are heartbreaking. The FASTEST trial enrolled 626 patients across 6 countries. Half received the drug, half placebo. The drug worked exactly as designed. It reduced hematoma growth and total bleeding volume significantly. But when researchers looked at patient outcomes at 6 months, there was no difference. The drug did not reduce death. It did not improve disability. All that effort and it failed to help. Why did a drug that stopped bleeding fail to improve outcomes? The answer is humbling. The initial impact of the bleed, the blood spreading within minutes, causes much of the permanent injury. By the time patients reach the hospital, the damage is already done. The brain does not heal like skin or bone. Dead neurons do not come back. We need treatments that promote brain repair. There was also a safety signal. The drug increased the risk of life-threatening blood clots to 5%. The bottom line for families is sobering. Recombinant factor VIIa stops bleeding, but does not improve function. If you or a loved one has a brain bleed, get to a stroke center immediately. Every minute matters. Share this with someone who needs to understand. Knowledge is the first step. Knowledge is the first step to better treatments.